18-year-old senior in This is Pat, an 18-year-old senior in high school. She got her wisdom teeth removed a few months ago and was prescribed Oxycontin for pain. She began visiting many doctors seeking for more medication. Her addiction to Oxycontin led to heroin use. Pat lost her job and has been getting bad grades as her need for heroin increased. Pat's mother, Lauren, brought her daughter into the treatment center to get help after incidences had occurred.
Hi, my name is Jennifer and I'm a your nurse today. How are you?
I'm Pat.
Lauren. Hi, Lauren. Okay, so I'm going to do a quick assessment and ask you a couple of questions. Are you okay with your mom being here?
Yeah, that's fine.
Okay, so what brought you in today?
Well, my daughter's been using heroin and it's gotten out of control. She lost her job and now she's been stealing money from me to buy drugs. Now I'm worried she may not graduate. I don't even know what to do anymore, so I brought her here for help.
Okay. Well, I'm going to ask you a few screening questions. Do you smoke or use tobacco?
I mean, sometimes with my friends, but it's just kind of recreational. I mean, maybe like half a pack a day.
Okay, well, would you consider using some of our smoking cessation resources we offer, like nicotine patches or counseling?
I mean, I would consider the patches maybe. I don't really want to get counseling about smoking. I mean, I'm not addicted to cigarettes or anything, but I mean, I guess we can talk about it later.
Okay, well, I'm glad you're considering it. In the past year, have you had 4 or more standard drinks per day?
No, I don't drink.
Okay, good. And in the past year, have you used prescription drugs more other than prescribed?
I mean, I got my wisdom teeth removed, what was it, like 6 months ago?
Yeah.
And then they gave me Oxycontin for that, so I used that for pain, and so I mean, I guess, yeah, I used to use it more than it was prescribed, but I don't have it anymore, so.
But it's gotten worse. She started abusing the Oxycontin she bought from her friends, and now she started using heroin.
Do you still use the OxyContin?
No.
And in the last 12 months, have you been intoxicated on alcohol or drugs where you could have hurt yourself or hurt others?
Well, I mean, I drive to school every day, but I mean, I'm careful and I'm a good driver, so I don't see how that really affects anybody else. I mean, if I want to be high and drive to school and crash into a ditch or something, I mean, that's only affecting me. It's not like I'm hurting anybody else, so I don't see why everyone can't just mind their own business, and especially people that don't understand. Like, you don't understand, so I don't see how you can even butt into my life.
Okay, well, I'm going to bring Nurse Carolyn in here to talk to you a little bit more about your substance abuse, and we can talk about ways of treatment and how we can help your addiction.
Okay.
Hi, Pat.
And Carolyn.
Hi.
Okay. And is it okay if we talk about your substance use?
I guess so.
Okay. How did you use heroin?
I mean, I usually shoot up before school and during lunch, but I mean, sometimes I will at night if it's been a really stressful day, just because it helps calm me down and lets me go to sleep.
Okay. Well, your heroin use seems to be above safe limits, and I'm concerned about how they may be affecting your health. Just by using unclean needles, you run the risk of contracting hepatitis, HIV, or various other infections.
I mean, I've heard about that stuff, but isn't that like, I mean, don't you have to get that from somebody that's like already sick? I mean, all of my friends, none of my friends have that. So I mean, if they don't have it, I don't know how I could get it.
Well, not necessarily. You never know who your friends are using with when you're not around. Now, I understand you are not ready to completely give up heroin, but would you consider using our sterile needles during your treatment?
I mean, yeah, or you guys like give them to me, or?
Yeah.
I mean, I would, but I wouldn't want you to like tell anybody, because that'd be really awkward and embarrassing.
Of course. It'd be completely confidential, only your healthcare team and I would know. Now, I'd like to help you cut back on your heroin use as well. Do you ever feel there are goals you'd like to accomplish, but your heroin use is holding you back from that?
I mean, I really want to graduate this year. I mean, so I mean, I would really need to improve my grades because they kind of suck right now. But I mean, I guess that heroin might affect my study habits, and like I'm late to class a lot just because, you know, I'm with my friends instead of doing homework or whatever. But other than that. But
Well, I understand that you lost your job and your heroin use is getting pretty expensive. Plus, not using heroin may affect your friendships and your ability to function. That must be pretty difficult to cope with.
it is difficult, and none of my family seems to understand that. I feel like the only people that actually get it are my friends, and I mean, they use heroin too, so it's really frustrating. I don't know. I mean, even if I wanted to quit, I wouldn't know how to start because then I feel like I would lose all of my friends. I mean, I don't know how I could live my life without my friends. I mean, it's already difficult enough being a teenager as it is.
Well, would you be willing to discuss some treatment options that might help you slow down on your heroin use? Dealing with your friends and family can be pretty difficult, so we want to help you with that as much as we can.
I mean, if you could help me like to quit and still like be able to have my friends and stuff, like help me through that, yeah, I would talk about it.
I think some type of treatment sounds good to me. We'd love to hear the options.
Well, one option we have is to go to a treatment facility.
I don't know if that'd be the best option because I really want her to finish high school and it's pretty expensive for us. So are there any options here?
Well, another option would be to try outpatient therapy. You would attend frequently, and we also have a variety of medications you could try.
What do the medications do?
Well, there's medications like Suboxone and buprenorphine, which prevent withdrawal and help reduce cravings. We also have methadone, which you can take daily, and there's fewer side effects.
That would be pretty cool if it would prevent withdrawal symptoms because I had that happen once and it was like the most horrible experience I've ever had. So, I mean, I'd be willing to try that.
I think that'd really help her quit and I don't want her to be in pain. So I think the medications would be beneficial.
Great. Well, that took a lot of courage for you to decide to take treatment. I look forward to meeting with you guys next week, and I'll send the doctor to go over your medication.
Thank you.
Pat started the meeting in pre-contemplation phase with no plans of changing her use. At the end of the meeting, Pat was in the preparation phase, planning on beginning medication therapy as well as twice-a-week treatment. Pat will start seeing her doctor next week. During these upcoming visits, she will receive help to deal with her life stresses as well as relationships and other emotional problems.